Good morning. Thank you, Dr. Sharif, Chairman SPECTOR SICOT, for giving me this opportunity to speak on amputations, a rational approach and rehabilitation regarding prosthesis. I am Dr. Sakti Prasad. I am from Odisha, India. I will speak on amputations, definition, levels of amputation. We should know what is the ideal stump, general principles of amputation, description in detail, and prosthesis considerations. So, if you define amputation, it is the surgical removal of all or part of a limb or extremity, such as an arm, leg, foot, hand, toes, or finger. Etiology, if you see the causes, trauma, peripheral vascular disease, diabetic foot ulcer and neuropathy, malignant tumor, burns with its various types of deformities, many neurological conditions where there is sensation problem, deformity problem, ulcer is a problem, congenital anomalies of various types where amputation is necessary, as well as various types of infections where amputation is necessary. For example, this is a congenital anomaly. For treatment of prosthesis, it is highly essential to do amputation. Here we cannot treat a prosthesis or we cannot save a limb. So it is necessary to ampute in a congenital condition. This is another congenital condition. It got amputation from birth. So it also needs a prosthesis. This is a below knee amputation in adult with a deformity. We will discuss if a stump is complicated by deformity, what are the problems in treatment of prosthesis, as well as a congenital amputee where it is necessary to fit a prosthesis and what are the issues behind it. You see the levels of amputation for the upper limb, either maybe shoulder disarticulation, above elbow amputation, below elbow amputation, that is called transradial amputation, carpal level, as well as ray amputation. If you go to lower limb, then either hemipelviectomy, hip disarticulation, above knee amputation, below knee amputation, and many foot amputations around ankle and foot, like Symes, Chopat, Lisfranc's. We will discuss that. Levels, these are some of the ideal levels. 20 centimeter from the olecranon for above elbow amputation, 17 centimeter from the olecranon, 20 centimeter from the acromion in the upper limb, is ideal level, 17 centimeter of the olecranon is ideal, 25 centimeter of the greater trochanter in lower limb, as well as 17 centimeter of the knee joint. These are the various ideal levels where amputation will be helpful in prosthesis, because as much muscle is shaped, active muscles is helpful for the treatment of proper prosthesis. If you go to the foot, various types of amputation like Symes amputation, Chopat's amputations, Boyd's amputation, Paragraph amputations, Lisfranc's amputation, because these are end-bearing stump. End-bearing stump means here the person can walk on barefooted in the home, because in any type of prosthesis like above knee, below knee, you need a shoe. So in the home, person can walk without the prosthesis. So stump, ideal stump. Stump is the interface between the prosthesis and the human body. So good stump is necessary for prosthesis fitting. So it should be optimum length, should be rounded, smooth and gentle contour, should be firm and heal adequately. Opposite groups of muscles sutured together at the end of the bone. Muscles sutured in such a way that they will be converted into fibrous tissue and serve as an effective cushion. Muscular tissue is normal, otherwise there will be necrosis. There should not be no projecting spur of bone, because this will be the stump will be in when fitted, it will be painful. Stump should not be under tension, otherwise it will have pain. Scar position should be ideal. Adequate adjacent joint movements. For example, if a below knee stump is there, for prosthesis of a PTB prosthesis for the below knee, If there is hip movement is not adequate, then there will be problem. Or any deformity of the hip joint, there may be problem in fitment of the prosthesis. So stumps should be conical. They should heal by primary intention. There should not be any non-projecting bone, a myoplastic. Both the agonist and antagonist muscles should be tied to each other with proper tension, otherwise there will be deformity. No neuroma, no tender scar, and proximal joints should supple. So these are the criteria for a adequate stump. So for example, these are some of the below knee stump. This is a below elbow stump, and this is a above knee stump. So you can see the shape properly, because once it's conical, the prosthesis interface known as socket can be fitted adequately or perfectly. So these are the various adequate length for a amputation in ideal situations. But prosthesis fitting can be done in any type of shape, size, and different type of deformed prosthesis stumps also. But these are the ideal where the patient can function better. So general principles when you ampute, there is two principles, either a myodesis or a myoplasty. Myodesis means agonist antagonist muscle should be stitched to each other so that there will be no deformity of the stump. And myodesis in the muscle attached to the bone. In certain conditions, it's necessary to attach the muscle, otherwise there may be deformity. So myoplasty prevents the deformity of the stump. Should be pulled distally and cut. Otherwise, there will be neuroma formation. Again, the stump will be painful when the person uses the prosthesis. Arterial veins should be ligated properly in two levels. Otherwise, it may slip and may cause bleeding in post-op. Bony prominence should be avoided. Bone should be properly cut. It should be smooth. It should be properly ruptured so that there will be no tension, or there should be no pain. And no doubt, length is important. General principles, suppose there is a cross injury, entrapment injury, sepsis, at that time, guillotine amputation is necessary. Guillotine is cut transversely so that post-operatively there will be no infection, and it will, once infection is controlled, the stump can be closed. So that is called guillotine amputation. Important is anatomy. We should know at which level, either below knee or above knee, or in the below elbow or above elbow, what are the muscles, what are the nerves, what are the vessels in that level. It has to be properly identified and tied. Otherwise, there may be complications when fitting a prosthesis. See, for the lower limb. Steps. Amputation steps are no doubt proper skin incision so that the stump will be conical. Muscle should be properly cut so that they will be closed properly. No doubt nerves should be pulled and cut. Sometimes we tie the also nerves so that there will be neuroma formation it is inside. Nerve vessels should be properly tied so that there will be no bleeding. And bone, no doubt, it should be smooth. And bone is always smaller than the muscles because muscles has to close over it to have a conical. So that is also a calculation to make where to the bone to be cut and what are the long length of the flaps so that this closure will be better and stump will be conical. So goals, analgesia, antibiotics, DVT prophylaxis. No doubt we should prevent uncomplicated wound healing. We should have uncomplicated wound healing. Edema should be prevented. Joint positioning and exercises. Drain removed in at 72 hours. Mobilize and rehabilitation are important parts. Complications, there may be hemorrhage, infection, skin breakdown, phantom limb pain and sensation, joint contractures, major bleeding, skin irritation. This has to be prevented. Major amputations, discuss few below knee amputations or above knee amputation. This is the photograph of a guillotine. You have to cut like transversely to control the infection. Below knee amputation in various lengths, either short length, standard length, and a long length also. In indication already we have discussed, so no doubt proper skin incision, proper muscle shape, nerves and vessels, proper properly management and bone cut. These are important. Always fibula should be shorter than the tibia. Otherwise, there may be projecting bone which will cause painful stop. Below knee amputation, this is the ideal level 15 cm tibia. No doubt anterior skin incision, posterior skin incision, and it is calculated and properly closed, taking care of the muscles, nerves, as well as vessels. Tibia transected anteriorly, fibula transpected 1 centimeter more proximally. Always. So these are the various steps of the below knee amputation. Big laser can be used to cut the bone. Skew flap is another technique which causes less pressure on the stomach. These are the stumps. You can see this person as in a stump, but then no doubt there is some bony projections here. Here also bone is growing a little bit, which will cause a painful prosthesis. Above knee amputation may be long, standard or short stumps, no doubt steps. Same skin, subcutaneous tissue cut with proper measurement, muscles, vessels like femoral vessels, and all the nerves, sciatic nerve, common peroneal nerve, all has to be managed properly to prevent the neuroma. So muscles either myodesis or myoplasty and the amputations. They are very important because these are the end bearing stop. End bearing stop means the person can walk on the inside, indoor by these terms. Symes amputation, pyrogops amputation, word amputation, list branch, chopart, these are the foot amputations. Usually these amputations come in short questions or people due to its interesting name, people also ask about these amputations. So Symes amputation level, chopart is intertarsal, list branch is tarsometatarsal, or sometimes tarsal, transmetatarsal or ray amputation. These are the various levels of amputation. So ray amputation, one of the important cause is diabetes, where you may have to resect at least a toe, either grade toe or second toe. These are called partial foot amputation. Symes amputation disarticulate the foot with removal of both malleoli, 0.6 centimeter proximal to the joint lines. Amputation end bearing stop that in many circumstances allow ambulation without a prosthesis over short distances like indoor activities. Void amputation, this provides a broad weight-bearing surface of the heel by creating an arthrodesis between the distal tibia and the tuber of the calcaneus after talectomy. So the talus is removed, all the foot bones removed. Now the calcaneum fixed to the tibia, and the person can have a end-bearing stop. Chopard amputation is intertarsal amputation or mid-tarsal amputation. List branch amputation at the edge of tarsometatarsal. These are partial foot amputations, but it has got a complication many times. Tendon balancing is highly essential, otherwise this may go for equinus types of deformity. So it has to be done properly. Pyrogop amputation is another end bearing stop. You rotate the calcaneum so that it fuses the tibia, and person can walk also barefooted in the home. If you come to the upper limb, either upper limb, if you go from below, may be ray amputations or transcarpal amputations. Below elbow amputation may be short, medium, long length. Similar principles of managing muscles, nerves, vessels, and bones. Proper stump, no neuroma. So everything is same, and also above elbow amputation. Same. We have to follow the principles of amputation, like either myodesis or myoplasty, no neuroma formation. But the pre-prosthetic preparation. Prosthesis is not an ornament. We can use immediately fit to the limb or the stump. So it needs some preparation. So position is important. If you don't keep properly, then there may be deformities, like in the above elbow, above knee stump, maybe flexion deformity, adduction deformity. In the knee, maybe flexion deformity. So this has to be prevented. Stump bandaging, many times, any type of amputation, we can make it conical shape, various types of stump bandaging. These are the practical things we have to learn. Otherwise, we will ampute, but the prosthesis fitting will be problem. Then it will lead to revision. So stump bandaging is an important part of the stump management or proper conical, making proper conical shape of the stump. For example, a child having a above knee amputation and proper stump bandaging. Remember, long time person should not be sit like this. Either he should sleep prone or supine. Without, or if they would sit long time like this, it will go for a deformity of the flexion deformity of the hip joint, in which fixes prosthesis fitting will be a problem. Skin care, many times skin hygiene, lubrication, skin inspection, these are important part. Otherwise, there may be skin conditions like various types of dermatitis, maybe due to prosthesis fitting or pre or post. Physiotherapy, residual limb shrinkage shaping is highly essential. Limb desensitization, maintain joint range of motion, strengthen the residual limb, maximize self-reliance, and patient education. How to use a prosthesis, these are important. Exercises, main aim is to improve the range of movement and the muscle power of the limbs for better working of the prosthesis. Pre-prosthetic management, so strong exercises, otherwise you go for deformity. That has to be range of movement, muscle power has to be managed properly, otherwise fitment of the prosthesis is a problem. Limb strengthening, muscle strengthening is highly essential. Self-care, upper limb amputee, they has to be taught properly self-care because it is most of necessary. Suppose a below elbow amputee or a above elbow amputee, how to use gloves, either opposite limb or foot, how will write. So these are very, very essential training by occupational therapy is highly necessary for a fit upper limb amputee. So coming to the fitment of prosthesis, a prosthetics is a person. Prosthetics is a person who, prosthetics is a science in which fitment of prosthesis, the technology, everything is taught. Prosthesis is the device known as prosthesis. Prosthetist, the person who himself is qualified to prepare a proper prosthesis. They are taught with various types of knowledge of the anatomy as well as the biomechanics, material science, so that they can make a beautiful prosthesis which is used by the amputee. So prosthetics is a unit of rehabilitation medicine dealing with the replacement of the whole or part of missing extremity with an artificial device. So commonly used prostheses are either above knee amputations, below knee amputations, signs or partial foot amputations. So above knee amputation, socket are many types, but commonly used quadrilateral socket. We'll come to that. Below knee amputation, PTB socket or patellar tendon bearing prosthesis, patellar tendon bearing prosthesis, the socket, Canadian science prosthesis for science amputation, partial amputation, various types of shoe fillers are there. For example, these are the component of prosthesis. This is known as socket. This is a rotator adapter. This is the knee joint. Many types of knee joint. 4-bar linkage, single axis, hydraulic, pneumatic, many types of knee joints. This is the shank, maybe aluminum, carbon fiber, or any types of material which is lightweight and strong is used. And no doubt ankle joint and foot. If this is for the above knee amputee. For the below knee amputee, this is the socket, this is the adapter, this is the tube, this is the ankle joint and foot. So there is a above knee, below knee. These are components of the upper limb prosthesis. For any type of prosthesis, there is a no doubt there is suspension mechanism. Commonly silencian bandage is used in above knee prosthesis, but there are many other types of suction systems are there. So this is itself is a big area we cannot discuss here in this short lecture. So component of prosthesis, this is the suspension system, this is the socket, this is the tube, this is the foot and ankle, and this is the socket in the above knee prosthesis, knee joint and shoe, and these are for the upper limb. Harness system is there, and as well as the socket, control cable in manual systems. There is a control cable system which helps in opening and closing of the terminal device or hand. Hand portion is known as terminal device. Its opening closing controlled by either control cable or myoelectric system. So above knee prosthesis, socket, how you can see a prosthesis fitted with the person. It is a very, very technical demanding subject in which, because prosthesis fitting causes so many complications. So if you do not measure perfectly, stumps, socket preparation, length of the prosthesis. So prosthesis, only suppose you do a amputation, the prosthesis fitting not easy. You have to go through various types of trials Materials also highly essential for treatment of prosthesis. Durability of the component. So naturally, it itself is a science which has to be read perfectly by the prosthetist. And nowadays, for the preparation of socket, CAD/CAM system is there to make a proper fitment of the prosthesis. Below knee prosthesis, you can see a stop. Below knee prosthesis is prepared, the socket, and also prosthesis is prepared. These are the above elbow amputation prosthesis. This is below elbow amputation prosthesis. You can see these are the suspension system. Otherwise, the prosthesis will fall. And this is the control cable. By various type movement, it has to be trained. The person has to train to use this prosthesis. Otherwise, elbow flexion, elbow extension, the terminal device or hand portion opening, closing, all are controlled by the muscular system of this part of the limb, stump as well as this scapular muscles. So it has to be trained perfectly by occupational therapist. I'll train them to use this prosthesis. And these are the suspension system, but this is the control cable for opening. And these are the myoelectric. This is another science person by the stimulation or the electrical stimulation comes out from the muscle by which the stimulation this prosthesis can open or close as per our wish. So no doubt this is now the best prosthesis system, which is a myoelectric prosthesis. And Canadian science prosthesis for a science amputation. Foot is an important mechanism of the prosthetic system. So foot has got a previously satch foot or solid ankle push on a heel, and there is energy storing foot also system is there which works better because immediately there will be heel raise after this toe strike. So these are also developing, and we can see in Paralympics how they run with these types of foot mechanism systems. In India, we have got a foot known as Jaipur foot developed by Professor P.K. Sethi, so known as Jaipur foot, because in any prosthesis somebody uses, you have to do a use a shoe. In India, if you say as per the custom, we don't come to the home with a shoe. So naturally, we need a foot which is washable, durable, proper motion is there. So a locally made food mechanism known as Jaipur food developed in India, which is used and also highly successful in maintaining the gate mechanics as well as the washing system, as well as it is somebody can use it in home also. So Jaipur food is a very important for the countries like developed countries like India and its neighboring countries. So making an amputation or doing an amputation are important. So we have to shape the limbs properly. There should not be any neuroma. It should be proper shape, conical, stump exercises, no deformity. This has to be our job to make the prosthetic fitment easier. So the multidisciplinary rehabilitation team, the patient, doctor, nurse, social worker, psychologists, prosthetists, vocational rehabilitation workers, all we help to patients achieve the highest possible level of function and participation in life, various types of activities, including the sports activity. Thank you very much for the opportunity. Thank you, SICOT. Thank you, Chairman, SPECTOR Committee.